Hello everybody, welcome to Community Conversations. My name is Luke Margolis, and today I am joined by Dr. Walter Rosenfeld. He is the Chair of Pediatrics at Goryeo Children's Hospital, and he is the Medical Director of Children's Health for Atlantic Health System, and this is his second appearance on Community Conversations. Welcome back, Doctor.
Thank you very much. Pleasure to be here.
Good to have you back. So for those who have just tuned into Community Conversations for the first time, I'll explain a little bit about how this works. Dr. Rosenfeld and I are going to chat for about a half hour, give or take. We're going to cover some ground on our declared topic, which is back to school. That's what this community conversation is all about. But we're going to touch on a number of things that have to do with the health of all of our young people, children's health. So that could include things like back to school. It could include things like behavioral health, nutrition, all that stuff. We're going to cover the gamut. In fact, much of what we can cover is directed by you. We fielded some questions ahead of time before this event. But if you have a question based on something you hear us talk about, or maybe you hear something that one of your friends have said and you want to find out quite if that's true or not, feel free to put your question in the chat box there. We will get to as many of those as we can in the time allotted. And of course, if you have to miss any portion of today's event, the entire community conversation will live both on our Facebook page and on our YouTube channel. So subscribe there and you'll never miss a community conversation, but also on our website, atlantichealth.org, where not only can you find community conversations, but you can find a doctor profiles for individuals like Dr. Rosenfeld and his peers, all kinds of information about Atlantic Health System, certainly stuff you won't want to miss there. So that is how this works. Let's jump in. All right. Good. So we said back to school, but back to school is going to come with seemingly, even maybe more so than last year, a lot of additional strings attached. I want to start first with the one that, of course, everybody's talking about, and that's some of the COVID-19 related strings that revolve around back to school. One of the ones we're hearing about first is masking. We know for adults, at least in many professional settings and in large congregate settings, masking has worked to keep down the spread of the virus. What about in schools? Does masking seem to work with kids too, like it does with adults? What do we know about that?
Yeah, absolutely. Well, you know, we've learned so much in the past year and a half about this. We don't have all of the answers, but many people are studying all the beneficial things to do, things not to do. Masking is one of the things that has been determined to reduce the rate of spread of COVID virus. By the way, spread of other viruses and other illnesses, which I think we'll get to a little bit later.
Sure.
But it is really important. I like to think about how we approach this as a layered effect. So maybe we'll get to it later in more detail, but I think everyone knows that vaccines are not available for younger children, children less than 12.
Right.
So, and that has scared parents sending their children back to school. I get it. That is a concern. So what can you do given that children less than 12 can't get the vaccine right now? Masking, separation, hand washing, some of the things that we've been talking about for a long time. And there is very good data now from multiple studies around the world and around the country that masking does prevent the spread of infection.
Do you think masking is dangerous? There have been some folks who have said, look, you know, you're asking kids to wear masks for a while. Has there been any scientific evidence that suggests that masking children could be dangerous?
There is no evidence whatsoever. And in fact, you know, there are some people that are concerned that their child has asthma or has some other respiratory disorder, and will masking be a problem? Except for the very young children less than 2 years of age, masking has been found to be safe for children of all ages. Now, I've heard parents say, well, what about germs getting into the mask and my child wearing the mask over and over again? That's just not shown to happen, but let's say that your child does have a skin infection on their face, like impetigo. I would change the mask frequently. Wash it if it's a washable mask, get a new cloth mask. Remember, we're in a different place than we were a year and a half ago. There are plenty of masks available.
That is true.
There are many more things that we have now at our fingertips that we didn't have before.
You talked about vaccines, so let's go there. Right now, you're correct. We know that COVID-19 vaccines are available for children over the age of 12. But not the vaccine, at least from the statistics that I've seen, show that not everybody over that age cohort has received their vaccines yet, similar to adults, although the number I believe is even smaller. What do we know about how kids are doing with the vaccine?
Yeah.
Is it safe for kids to take?
Yeah. So I want to go back to that concept of layers of protection. So I'm going to start from a different point and get right to your answer.
Yep.
To send kids safely back to school, we want to make sure that all the school personnel are vaccinated. They are all over the age at which they can be vaccinated. We want to make sure of that. We want to make sure that they are masking and separating and supervising the right kind of care. For children 12 and above, they are all permitted to be vaccinated, and we're struggling with that a little bit. We don't have the rate of vaccination that we really need to get to really prevent spread of infection.
I think it's in like the 40s%.
It depends on which community you're in,
yeah.
but it's much lower than the population overall. And look, I think part of that is parents are anxious. They're worried about their adolescent child. They're worried about side effects. You know, you see things on the internet. There is a lot of data now. A lot of people have received the vaccine. Are there risks? Of course there are risks to anything, but the risk of not vaccinating is huge, and we know that. And just look around the country at the states and the communities where there are very high rates of people getting admitted, getting very serious COVID illness, and even dying from it. Those are mostly in places, almost exclusively in places where vaccination rates are low.
We saw, I'm thinking back to when you joined us on set last time, which was last summer, which was right around back to school time, and we were talking about, we were quite grateful in fact, that at least at that time, the amount of children that were contracting then the original strain of COVID-19 seemed to be low. I think there might have been an alpha or beta variant at that point, but it was just not affecting children at a high level. How is the Delta variant doing with children?
Okay, so the Delta variant is highly infectious, much more so than the prior variants that we've seen, and that holds true for children as well, that it is much more transmissible. And again, that's why you're seeing in states where there is poor vaccination, higher rates of children as well as adults getting admitted to hospitals and having very serious illness. Again, the layering concept.
Yep.
The more you can get people eligible for vaccine to be vaccinated, the more protection we're providing for children. So yes, Delta is more contagious. I know a question that's come up very frequently: is it more virulent? Does it cause
worse?
Does it cause more serious disease in adults and children? And I think the answer to that is still out. It's not entirely clear. But what is clear is that transmissibility is much easier with Delta. And it's just another reason why we've got to get more and more people vaccinated.
All right, folks, so Delta is more transmissible. Masking and vaccines right now are our best defense against this, and that's not just for adults, but that is for kids too. So there's a lot we want to cover, not all of it, of course, having to do with COVID as it relates to back to school. Usually, if you and I were conducting this conversation 2 years ago, let's say, there would be a whole host of things that we would be talking about as it relates to children's health and going back to school. Have those all gone away because we are focused on COVID, or do we need to still pay attention to some of those things? And if so, what are a couple of those things? RSV, what you name it, what are a couple of those things?
I've been talking about this for 2 years. I am very worried about parents not bringing their children in for their routine vaccinations and routine health care. And what we are seeing, and I think it's being seen around the country, is many children that are coming in for care with other respiratory infections. Now, some of those you can't vaccinate against, but there are some childhood diseases that can be vaccinated against so that you prevent them. So let me first answer your question directly and then go back to those other diseases. So we're seeing a real uptick and a very early rise in RSV, respiratory syncytial virus. People always think of that as a childhood virus, but adults get it as well, and we're seeing it in adults. We usually have a real rise of cases in October, November, December. We're seeing it in August and now. So we're concerned about that. There's something enterorhinovirus, which can cause the common cold, but it can also make you quite sick. And then a whole host of other viruses. And so I want to put a plug in right now for influenza, because we're not yet in influenza season, but we will be soon. Right. This is something that you can help prevent by getting people vaccinated. If we get children vaccinated, and the vaccine is approved for children, it's been for years, we will decrease the numbers of children with influenza.
So, but what about, we want kids, at least the eligible kids, to be vaccinated against COVID too. Is there a problem with getting your COVID shot and then your flu shot?
No. Look, the problem is it hurts. Children don't like.
They don't love getting shots, right?
And there is an immunologic effect, and sometimes you get fever and achiness and a sore arm. So I don't want to make light of that, but there's no harm in getting those vaccines together. You can get them at the same day, you can get them spread out at intervals, but the important thing is to get vaccinated. If I may, Luke, I want to get back to that question about other childhood illnesses, because this really worries me. Of course I'm concerned about COVID and making sure that children are protected, but I'm also concerned about measles, mumps, rubella, even things like diphtheria. There are childhood illnesses that we eradicated or near eradicated, and if we know from the story about measles a couple of years ago, if you have communities where there is poor compliance with immunization for measles, the rates of measles goes way up. And measles is a very serious disease. Measles has the potential to be a very, very serious disease. So we've got to get kids in for their routine health care, including immunizations for things for which we have immunizations.
So I want to thank everybody who is submitting some questions. I know we have some that are starting to come through, and for those who have submitted questions ahead of time, I'm going to continue to try to weave those through as we can. Before we get to some of those though, this is like usually when I make my sort of regular statement about this kind of thing. You are welcome to share any unique circumstances to yourself or to your children or anything along those lines. But we always have kind of a rule here on Community Conversations that we'll give you the best general advice and guidance around the circumstances you're raising. But if you have a specific question about you or your child, those are best directed to your pediatrician or your physician who know you best. And so with that, I'm going to ask you, how important, if for those parents who may not have a relationship with a pediatrician yet for their child, and they figure, or just haven't gotten around to establishing that unique relationship, how important is that relationship for a child's development and health over time, having a pediatrician who knows your child very well?
It's critically important. I mean, you have to pick in life people that you trust, people that you can rely on. There is nothing more important. I've not met a parent who feels that their child's health is not the most important thing. And you need somebody that you can trust. You have to develop a relationship with your pediatrician. We have a wonderful group of pediatricians and family medicine physicians who are on our medical staff at Goriab Children's Hospital, Morristown Medical Center, Atlantic Health System, our whole system. Wonderful doctors. You need to find the right one for you and for your child, and then rely on them. They should be your trusted source of information. So go to the CDC website, look at what they say. Go to other reliable websites, the Mayo Clinic, Atlantic Health System. We have all kinds of good things on the website. But then, as Luke just mentioned, when you want specific information about your child and how it applies to you, you need to rely on your family doctor, your pediatrician.
So let's take a couple questions. So Danielle has 3 questions. 2 are sort of related, and I think actually I might be able to address some of her questions there. And then the third one, specifically, I'll need your help with Dr. Rosenfeld. So Danielle wants to know, what about kids who will turn 12 a week or 2 after the Pfizer vaccine is approved? So the Pfizer vaccine has been approved by the FDA, if I understand correctly. So Danielle, I think if I understand your question, essentially it's those kids who are sort of on the cusp. They are not currently children who are, it's kind of black and white in terms of the guidance we've been given. If the child is under 12, they are not able to receive the dose. But if they are, once they turn 12, then they will become eligible to receive it. I know some
let me just clarify one thing though. The Pfizer and Moderna vaccines, and then Johnson & Johnson vaccine a little bit later, were approved in about December of 2020. 2020. They were approved under something called emergency use authorization. But recently, the Pfizer vaccine was given its formal permanent approval. And
by the FDA.
By the FDA, thank you, yes. And so they're approved. So Danielle, your child will be able to receive the vaccine as soon as they turn 12.
And you should feel comfortable doing so.
And please.
So another question she has is regarding the potentiality for lower doses for children. I'm assuming you mean under 12, Danielle. We don't know about that yet. To my understanding, there has not been any guidance around that yet, and the government has not made any announcements on what the dosing rates will be for children under 12.
Correct.
Is that right?
We are all of us, anxiously awaiting the FDA's looking at additional data, because they asked for more data than the pharmaceutical companies provided initially, so we can get release of vaccine for children less than 12 years old.
Finally, last question, and this is a question about schools specifically. Best recommendations for how kids can stay safe in school during lunchtime. Now this is hard, right? Because at some point you're going to have to take the mask off to eat. And I know that schools are working really hard, and your district, no doubt, is working quite hard to ensure that there is spacing to the best that they can supply it for a lot of these environments. So there's no real magic wand we can wave here, but if there's any guidance we can share on masks.
Yeah, it's actually a great question, and you have to do the best you can. So the schools are very attentive to this. They're trying to spread children out during lunch. If it's possible to have lunch and recess outside, where now we have really nice weather, great. Sure. That really reduces the risk.
Yep.
And then I think just you have to have that time period limited where you're eating without a mask. And that's the best you can do.
So a lot of where, you mentioned it towards the beginning, but a place of where a lot of these questions come from and a lot of where the concern comes from is the anxiety that a lot of folks are feeling around back to school. And that is not unique to just the parents. Kids can get anxiety and concern too. How concerned are you about the behavioral health and emotional health of children? And what are some things that we need to keep in mind, or parents can keep in mind, about keeping an eye out for some of that kind of stuff?
I'm so glad you asked that question. So we need to get kids back into school as safely as possible. School is not just about learning, it's about learning about socialization, being with other children, having defined limits, setting rules. School is such an important place where all of that happens. So we need to get children back into school, but safely, and as safely as possible. So what we want to do is, and listen, let's really think about this. As adults, we really understand. We have much more ability to think in abstract terms and long-term issues than especially younger children do. We're taking children, many of whom were home most or all of last year, or we're doing hybrid learning, and we're saying, now you're back in school full-time. That's a big adjustment. And what we've seen over the past year is a major increase in rates of anxiety, depression, eating disorders, other mental health disorders. I'm expecting that to go up even further, because school, while for many children will be comforting and will be, after maybe a brief adjustment period, will be grounding for them, for some it's going to raise their anxiety, that adjustment. I think what parents can do is to recognize that, anticipate it before it happens, begin to talk to your child, begin to get them into the mode of what it's going to be like in school, and then to be looking for signs and talking to them about what their fears or anxieties might be.
Do we at Atlantic Health System have resources for parents? Where do you turn if you're a parent who says, I can't put my finger on it, but there's something not quite right about the way my child's behaving right now. What do you do?
Yeah. So what I always like to say to parents is, you should not assume that you have to be the psychologist or psychiatrist for your child. In fact, if you're a psychiatrist, you shouldn't be the psychiatrist for your child. So when you're seeing signs in your child that make you worried or concerned, talk to that trusted person. usually it's your pediatrician. It could be someone else. It could be a school teacher, a guidance counselor in school. But talk to them. Let them know your concerns and have them help you, work with you to understand better what's going on with your child.
That's good advice. So we touched on it just briefly a moment ago, but this is something we're dealing with in my house a lot. Back to school meant earlier bedtimes. It meant, a little more of a focus perhaps on structure. How important are those things for kids? I know nutrition we talk about at school is a huge deal, that school is often a place where children have their best access to wholesome and nutritious food and exercise. But those pillars, when we talk about things that keep kids healthy, where do those things slot in?
Yeah. So again, I think our focus has been on all of the worry about COVID, and to some extent, many people have kind of ignored some of the basics.
Okay.
Good nutrition, sleep, exercise. Kids thrive on this. They need this. And many of them have not been able to get it. Now, some have had a lot of it. And what they need, some of those children, are boundaries, because they've been allowed to
run around all summer long.
Do anything. So all of that's okay, but as adults, as parents, as healthcare providers, we need to focus in on that. So you had asked me before, and I don't think I completely answered the question about resources here at Gloria Children's Hospital and Atlantic Health System. We have many resources. We have therapists, psychologists, psychiatrists. We have people that can answer questions about those things. We have a large eating disorders program, and of course we have seen such a rise in cases of young people with quite serious eating disorders like anorexia nervosa. If you have a concern, start with your pediatrician, call us. There are lots of numbers. When you go on our website, you'll see them.
It's all there.
And we will connect you with those resources.
Perfect. There's even a little chat box right there on the homepage of the website, and if you entered in a phrase like eating disorder, you'll see options populate in the field below, and you can click on those and to Dr. Rosenfeld's point, find phone numbers, email addresses, all that good stuff. So a topic that I wanted to touch on, because it's, again, sort of near and dear to my heart, but I mean, so look, I've got devices here, there's a device here, you've got devices, we've all got devices. And for adults, that's kind of how we conduct business and communicate with each other and stay in touch and all that stuff. But for kids last year, it was how they went to school in many cases. iPads, computers, tablets, things like that. And so my kids loved it. They were a huge fan of devices. Is there a risk there that kids can be on devices too much? How do you strike a balance in something like that?
So I would go back to what you just said. Kids use devices to communicate, to do their business, to do all the same
Watch community conversations.
Yeah. All the same things that we use it for. And I really do think that's a good starting point, because we sometimes think this is frivolous or unnecessary for children, but they rely on those devices too. So starting with that, they often need devices for certain specific activities, including social activities, but there needs to be limitations. And like everything else in childhood, parents have a job. Parents have the job of setting limits. That's what they are supposed to be doing. Children thrive in households where parents are clear about what limits are. Limits about lots of things: substance abuse, sexuality issues, using devices. Children do best in households where there are clear limits about those issues. And when there's the inevitable going past what you should do, like being on the iPad for 6 hours rather than the 1 hour that you said was permissible, you need to have a discussion about that, maybe a consequence, but there needs to be a way to get your child back on stream so that they are doing what they need to do.
So it sounds like you're talking about discipline.
Yeah, absolutely.
That's straightforward. So one last thing, we've got time for one more. It's a short one, but I just wanted to touch base on it too. It's sort of tied to me in with the devices a little bit. Telehealth was a big deal for adults. Now I know that it's not the answer for everything, but has it been useful at all in the pediatric space?
Yeah.
Have you guys used telehealth at all throughout the pandemic?
The pandemic did at least one really good thing, and that's it taught us how helpful telehealth can be. Okay. So what we found is it has enabled us to keep in better touch with our patients. However, like we're talking about overuse, it can be overused. And most doctors that I know, and for myself, there's a limit to how beneficial telehealth can be. Right. So it can be very useful for follow-up visits, quick visits, things where you really don't need to be in person, but we really want patients to come in to be seen. There's nothing like having an in-room, in-person discussion, having a physical examination, that really makes a difference. So there's not one answer to that question. Telehealth, I don't want to see telehealth go away. It is not going to go away.
No, it's
we found
here
it
to stay.
Really useful, but it's got to be mixed in the right way. And we're still trying to work with all of you on what the right balance is.
Well said, well said. We have another question that's come in. It's a little more off topic, but I think it's important to reinforce on the vaccine side of things. Are you more or less susceptible to serious hospitalization from the Delta variant if you're vaccinated?
Okay.
Does the vaccine make you more or less susceptible to hospitalization from the Delta variant?
This has to be made as a really clear point. The vaccines were designed to not necessarily prevent infection, but to prevent serious infection, hospitalization, death. And they are working better than most vaccines work to do those things. So yes, there are some cases you hear about people that were vaccinated and got very sick. Those are the exceptions by far. Getting vaccinated should prevent serious infection, serious illness, hospitalization, admission to an ICU. Getting the vaccine almost always prevents that. And that's the emphasis that we want to make here. Vaccines will prevent that. It is saving lives.
Saving lives. Dr. Rosenfeld, we have covered a lot of ground today. We got a lot of questions in. I greatly appreciate your time. Thanks for coming and joining us again.
It was great. Thanks, Luke. Thanks for having me.
All right. Folks, that's going to do it for us on this episode of Community Conversations. If you missed any part of this, please go to our website, atlantichealth.org, where you can see all of our community conversations there, or subscribe to our YouTube channel, where they all live as well. You can even find Dr. Rosenfeld's from last year and compare what we did last year to where we are now. So again, thanks so much for joining us. For Dr. Rosenfeld, I'm Luke Margolis. We'll see you next time.